Hi guys, this is Dr. Naidu, Family Medicine. We are going to learn about anesthetic drugs, USMLE step 1, 2, and 3. So, every single step you will get one question or two question at least on anesthetic drugs. So, but after today's lecture, you will be an expert in all the anesthetic drugs. Alright, so let's dive in. Um, First of all, CNS, central nervous system, is made up of fat. Blood-brain barrier is made up of fat. So for a good anesthetic drug, it needs to be fat soluble. Okay. So CNS drugs absolutely must be fat soluble in order to be actively transported. For a good CNS drug, it has to be fat soluble in order to be transported. Then there are that have drugs that have decreased solubility. Okay, drugs that have decreased solubility. The drugs that have decreased solubility are N2O, nitrous oxide. What is the benefit of decreased solubility? Means it will be rapidly you can have rapid induction, okay, and it has good recovery time. So rapid induction and good recovery time. So rapid induction and good recovery times is one of the benefit for nitrous oxide N2O. Another thing about increase so N2O, since we are on N2O, N2O also goes and fills up in hollow gas organs, for example our lungs. So this is lungs. N2O, when you achieve rapid induction, goes and fill up in the lungs. Okay, in the lungs, this is the trachea. Since it is filling up, there is already air in the alveoli, and N2O goes and fills up in the gas filled organs. It can also cause pneumothorax. It can cause pneumothorax. Okay, so what happens is air leaks out and goes in the pleural cavity. So you have pneumothorax. Drugs with decreased solubility has rapid induction, right? However, drug with increased solubility have increased potency. So increase in potency means increased solubility, which means that the drug remains in the blood for a long time. What is minimum alveolar concentration, MAC? MAC, minimum alveolar concentration, is uh, when you want to prevent 50% of the subjects from moving in response to a noxious stimuli. Noxious means painful stimuli. So, potency is inversely related to minimum alveolar concentration, MAC. So if you have increased MAC, you have decreased potency. If you have increased potency, you have decreased MAC. What is MAC? MAC is minimum alveolar concentration. MAC means you need amount of drug to prevent 50% of the subjects from moving in response to painful stimuli. So for example, if there are 10 people, m- uh, minimum, what is the MAC? MAC will be at least 5 people need to stop moving in order to a noxious stimuli, painful stimuli like skin incision. So you need high MAC and low potency, right? Low potency and high MAC in order for patient to stop moving. And how do you achieve high MAC with low potency? Low potency with drugs like N2O. N2O has decreased solubility, right? Decreased solubility means increase rapid induction and recovery times. So this is a main concept right here, potency and MAC. You need MAC for rapid induction to be high. Potency means once the anesthetic drug is inside the veins, it stays in the veins for a long time. It is good solubility, it has good solubility. Increased solubility means increased potency. Now let's see what are the two classes of anesthetic drugs we have. One is inhaled. So this is our nose. So the one that you inhale through the nose is inhaled anesthetic through the gas. So gas anesthetics, inhaled anesthetics are sevoflurane, isoflurane, and desflurane. Desflurane. So just like you get flu through the nose, right? Influenza like flu through the nose. The same way, sevoflurane, isoflurane, desflurane are inhaled anesthetics and they are given through the nose because they are inhaled anesthetics. What is the mechanism of action of inhaled anesthetics? We don't know. Mechanism unknown. Okay. However, we do know what are the side effects, adverse effects. So adverse effects of sevoflurane, desflurane, isoflurane. Number one is respiratory depression, decrease respiratory rate. Respiratory depression normal is 18 to 20. With anesthetics, it can go up to 8 or 9. Decrease in cough reflex. Decrease blood pressure. Decrease blood pressure. So those are the three. Decrease respiratory rate, decrease blood pressure, decrease cough. And what increases if blood pressure is decreasing? What will increase? Increase ICP, intracerebral blood flow, ICP, increase ICP, and decrease in metabolic rate. So next class of drug is IV drugs, intravenous IV drugs, drugs that can be given with the IV line. So what are the IV class of drugs? Number one is propofol. Propofol. Number two IV anesthetic drug is etomidate. Etomidate. Number third IV drug is ketamine. Ketamine. Propofol. Propofol drug. What is the mechanism of action? It potentiates GABA. GABA. It potentiates GABA. However, it inhibits NMDA. Okay, propofol potentiates GABA just like alcohol, and it inhibits NMDA. What else? Etomidate potentiates GABA as well, GABA A receptor. This is also GABA A receptor. So etomidate potentiates GABA A receptor, potentiates it. Okay. Ketamine inhibits NMDA receptor, inhibits NMDA receptor. So ketamine inhibits NMDA receptor. So let's learn about the adverse effects of all the IV anesthetic drugs. So number one adverse effect is of propofol that it decreases blood pressure. Okay, so adverse effects number one of propofol is it decreases blood pressure, decreases BP. Okay. It also causes decrease in respiratory rate. So, for example, somebody who is a COPD patient cannot get propofol, because if you give them propofol, the respiratory rate drops to the dangerous level and patient may be hypoxic eventually and die. Etomidate causes adrenal insufficiency and post-operative nausea and vomiting. Okay, post-operative nausea vomiting is a common adverse effect of etomidate. Adrenal insufficiency, nausea, vomiting, etomidate causes these adverse effects. Okay, ketamine. Ketamine, a lot of big cities like ketamine clinic, they have ketamine clinic, right, for untreated depression. They have inhaled version of ketamine as well. They get IV ketamine also. Some Hollywood celebrities get ketamine infusion. So what happens with ketamine? First of all, ketamine is a sympathomimetic. Sympathomimetic. Okay, increases sympathetic nervous system, like it would increase blood pressure. Okay, increase in heart rate. Okay, increase intracerebral pressure, increase cerebral blood flow. Okay, it also causes bronchodilation. This is the only drug that can be used in COPD patients. Ketamine causes adverse effects such as bronchodilation, causes increase in BP, increase in heart rate, increase ICP, intracerebral pressure, uh, by causing increased cerebral blood flow. Other side effects of ketamine is it can cause hallucination, vivid dreams. So right after surgery, when patients say that they were seeing things, that is because of ketamine. They were seeing people who were not in the room, that is because of ketamine. Okay, so ketamine can cause adverse effects such as sympathomimetic adverse effects like increased blood pressure, increased heart rate, increased ICP. Okay, other adverse effects would be hallucination, vivid dreams, and ketamine also causes bronchodilation. What is the mechanism of action of ketamine? It inhibits NMDA receptor. That's the end of all anesthetic drugs. Thank you.